Hello everyone, and welcome to another video of reviewhealthcare.org. In this video, we're going to be comparing 2025 commercial health insurance pricing and options, and we'll be comparing that to insurance alternative options like Christian Healthcare Ministries and Medishare. Just so you know, this is not a sponsored advertisement by any of the companies mentioned in this video. Commercial health insurance is what we all know. You pay your monthly premium, and before you get any of the major benefits, you have to meet this deductible, which is typically high. On average, it's about $5,000. We did extensive research among the bigger insurance carriers with better plans, as we want decent coverage. Now, this is based on my age for my area. Pricing may be different in your area, but trust me, it's not going to be all that different unless you're 45 years or older. Take a look at this comparison. Florida Blue Select 2341 cost $592.97, and you'll still have a deductible to meet over $9,000. That is just crazy. United Healthcare comes in around the same price per month per person, but the deductible is now only $2,500. For those who don't know, a deductible is the amount you have to pay out of pocket before the insurance will pay. This is not for your doctor's visits, but typically for testing, hospitalization, and/or surgery. The conclusion is that commercial health insurance in 2025 is just not affordable at all. Let me show you how nearly 10 years ago, me and my family saved hundreds of dollars per month. Let's talk about alternative health insurance options. What are these health sharing ministries? Christian Healthcare Ministries and Medishare are non-profit organizations and the leaders in health sharing ministries. Both have shown to be reputable and have decades of financial stability, unlike many of the newer health sharing companies out there. I am comparing the best plan from Medishare, their AHP 3000 plan, to Christian Healthcare Ministries Gold plan with CHM Plus. The pricing shown is for a 40-year-old person. I will give your pricing for other age groups in just a few moments. Please note that Medishare's premium is age and zip code related, so drop me a comment below with your zip code and age group, and I will let you know your pricing. Your deductible with Medishare will be $3,000 and $1,250 with Christian Healthcare Ministries. This is the amount you have to meet before the plan will pay. It's important to note that Medishare is the only plan which has an additional $99 fee per person per month for a health coach, which will be automatically assigned to you by Medishare if you don't meet their health criteria. Medishare bases this on your weight, cholesterol, blood pressure, pre-existing conditions, and some other criteria which is vaguely described in their terms and conditions. None of the other healthcare alternative plans have such a fee. Once you are considered healthy by Medishare, this fee will be waived. Let me show you the details about Christian Healthcare Ministries, or CHM for short. This is their CHM Gold plan with CHM Plus included. CHM Plus is an addition that covers an unlimited dollar amount per medical event or illness instead of $125,000 coverage per medical event. The CHM Plus fee is included in the amounts shown here. CHM has set pricing for their plans, regardless of your age, zip code, or your health status. The pricing for the Gold plan, including CHM Plus, is $287 per month as of January 1st, 2025. The price maxes out at 3 persons in your household. So if your household is a family of 3, 4, or 5 persons, you'll pay only the premium for 3 persons in total. Your annual deductible, or personal responsibility, PR as they call it, is $1,250 per person. Let me just real quick pull up those commercial insurance prices so we can compare it to these sharing ministries. Look at the least expensive commercial plan, which is the Florida Blue Select 2341. The cost per year is $28,462. with a $9,000 deductible. Compare that to Christian Healthcare Ministries with CHM Plus, $10,332 with a $1,250 deductible. Look at the savings. That is over $18,000 per year or $90,000 over 5 years. Crazy. Not to mention the deductible is nearly $8,000 less. This is just mind-blowing, and that's why we are so excited to share this with you. There's also a minimum qualifying amount you have to meet before you can get reimbursed by Christian Healthcare Ministries. This is $1,250 as well. We're talking about a total of all bills together for this one medical illness or event. This doesn't mean a single doctor's bill. I know this might sound a little bit confusing, so I'll give you some more detailed examples in just a few moments. CHM has no additional or hidden fees, while Medishare has the possible $99 per month for a health coach and a one-time fee of $52 when you enroll. There are no network restrictions with CHM. You can go to any licensed doctor, specialist, emergency room, hospital, any medical facility you like. One of the biggest differences is that you're considered self-pay with both of these ministries. It sounds scary, but it's really no big deal. Most medical offices have a self-pay policy in place, which is often a reduced fee of 40 or 50% or even more. For larger bills, CHM will expedite the payment after you inform them so you can get reimbursed faster. And meanwhile, you ask for a payment plan, which most of the medical offices can do for you. I'll go more into detail on self-pay a little bit later in this video. Learn more about self-pay and tips and tricks regarding self-pay on our website, reviewhealthcare.org. Comment below and I'll give you your personalized pricing for both Medishare and Christian Healthcare Ministries. CHM has a new program benefit called Advantage Care Solutions. This program is provided at no additional cost and is for people who need non-emergency surgery. If you qualify and decide to use this benefit, CHM will give you $1,250 towards your personal responsibility, making your deductible zero for this medical event. This means that you have no out-of-pocket expenses and you get everything reimbursed. That is if you have the gold plan. They also pay for reasonable, necessary travel expenses in case you have to travel for your medical treatments. The typical surgeries and procedures covered are orthopedic, ACL repair, general surgery, cardiology, ear, nose, and throat surgery, and more. Check out more details on our website. With CHM Gold Plan, you have the coverage for pre-existing conditions as soon as you enroll, so there's no wait time for pre-existing conditions. However, there are limitations, but they are so much better compared to Medishare. A pre-existing condition is a medical condition for which a member experienced signs, symptoms, testing, or treatment before joining Medishare or Christian Healthcare Ministries. With Medishare, you have to wait 3 years before your pre-existing conditions are partially covered, so no coverage until year 4 for your pre-existing conditions. Between the 4th and the 5th year, you get $100,000 for your pre-existing conditions, and after the 5th year, you will get $500,000 per year on your pre-existing condition. Let's take a look at Christian Healthcare Ministries. CHM defines pre-existing conditions in 2 categories, maintained and active. Maintained pre-existing conditions have immediate coverage. Maintained is defined as follows. You have 90 days without undergoing testing or treatment. You need no further testing or treatments. And medical records show that you're cured or are on maintenance treatment regimen. CHM has 2 programs for people with maintained pre-existing conditions. One is their Gold Plan schedule, which gives you the following coverage. In the first year, $15,000. In the second year, you get an additional $10,000, which makes a total of $25,000. And in the third year, you get an additional $25,000, makes it a total of $50,000 coverage in the first 3 years for your pre-existing conditions. After the third year, your pre-existing condition is no longer considered pre-existing, and you have unlimited an unlimited coverage amount for these pre-existing conditions. Many people ask us, what happens if in the first 3 years I have a claim for my pre-existing condition and it's more than what CHM covers? That's where the second program comes in. The total bills for a covered pre-existing condition can be added to a special program called the Prayer Page, which is listed in a monthly magazine called Heartfelt. Many members will donate to other members in need to help you with your medical bills. I read their magazine, and time after time, people are getting most, if not all, of their bills paid by donation of other members, which is an amazing Christian ministry, and that's really what Christian Healthcare Ministries is all about. If you have an active pre-existing condition, which is a condition you have signs and symptoms of right now before you join Christian Healthcare Ministries or Medishares, then the condition is usually not covered. What is a medical event? A medical event is an illness, disease, injury, or medical condition. A medical event starts at the first doctor's visit and includes medication, medical testing, lab work, radiology, procedures, surgeries, etc., all the way up until the last follow-up visit until you're cured or considered cured. With CHM, if one medical event adds up to be $1,250 or more for all the bills together, then you can submit for reimbursement. So in this day and age, that's real easy to reach. A medical event continues until one of the following statements apply. You're cured or healed, treatment is now at routine maintenance level, or you're 90 days without any kind of testing or treatment and no further testing or treatment is needed. If you have treatments over 90 days from the last event, CHM will consider this as a new medical event. A medical event may include some or all of the following items. And here's a list of non-covered items by CHM and Medishare. I have some great tips and tricks for non-covered medical expenses for you on my website, reviewhealthcare.org, and click on Frequently Asked Questions. Let's show you some examples how Christian Healthcare Ministry works in a medical event. In January, you go to the doctor for pain. The doctor orders an ultrasound, CT scan, and lab work. You also will have a follow-up visit. The total expenses for this medical event are $1,550. As mentioned earlier, CHM has a qualifying amount to meet before you can submit the bill. This is per medical event. So in this case, your bill adds up to be over $1,250, so that means you can submit this bill to CHM. You have a $1,250 personal responsibility, so your total reimbursement from CHM is $300. Now that you have met your annual deductible or personal responsibility, any other medical event in the same year above $1,250 will be fully reimbursed for you. See example number 2. Your personal responsibility of $1,250 is one of the lowest in the healthcare industry. This is like your deductible. Most commercial plans have a $3,000 to $10,000 deductible. Medishare has a $3,000 deductible, so big savings with Christian Healthcare Ministries. Here is example number 2. In the same year you go to the doctor for a routine checkup, the doctor wants you to do a colonoscopy and endoscopy as a preventive health care. Your total expenses are $2,250. Your qualifying amount is $1,250, which you exceed, so you can send the bill to CHM. Your personal responsibility has been met in the previous example, so you have no deductible. In this case, Christian Healthcare Ministries will reimburse you the full $2,250. If you follow our channel, you get access to other videos. There are some great videos out there which will give you answers to the most commonly asked questions. So here are some of our most frequently asked questions. You can find tons of frequently asked questions on our website, reviewhealthcare.org. Does Medishare and CHM cover medications? Both of them do cover medication if you have a medical event or incident, and 3 to 6 months thereafter. CHM could pay longer for your medication if there is a curable plan in place. For example, if you have been diagnosed with cancer and you need to take 6 to 12 months of medication, CHM could look at your medical records and likely approve that medicine. Both of them do not cover regular routine medication unless it's related to a medical event. So how do I pay for medication when it's not covered by Medishare or CHM? As routine medication is not covered, we at reviewhealthcare.org did in-depth research to give you some of the best tips out there. Option 1 is Prescription Hope. If Medishare or Christian Healthcare Ministries does not cover your routine medication, then you can try this alternative program. If you are in need of expensive medication, from $100 to $2,000 and more, you can get this only for $50 per medication for a 30-day supply. This is not a discount plan. It's called Prescription Hope, and it's for the more expensive FDA-approved brand name prescription drugs. Prescription Hope can get a brand name drug that's $1,000 retail for only $50 for you. You have to apply, but most individuals and families are approved. Here's a screenshot of their website regarding approval. Please note that Prescription Hope is a service. You likely can apply yourself at the manufacturer's website and get approved for low or no cost medication. Other than that, Christian Healthcare Ministries and Medishare both offer a prescription discount card. Now, these discounts bring medications way down. They're honestly good prescription discount plans. Like, I get my 90-day supply medication for like $30, $40, while normally it would be a copay of $50 with commercial health insurance. What does it mean that I'm self-pay? Because Medishare and Christian Healthcare Ministries are technically not health insurance, you're considered self-pay. It sounds a little scary, but it's really not. All it means is that you state that you're self-pay when you visit the doctor or a medical facility. Most doctors and medical facilities, like the emergency room, the hospital, have a self-pay fee schedule in place because they don't have to bill your insurance or deal with your insurance. You typically save a lot of money. You then can choose to pay in full or just ask for a payment plan if your bill is too high. My personal experience is that this is not an issue at all. Christian Healthcare Ministries has also help available. You can call their 800 number and they will help you in case the bill is too high and you can't afford it. With Christian Healthcare Ministries, once you submit a bill for a medical event, you have to wait 60 to 90 days to get reimbursed. Christian Healthcare Ministries sends a check directly to you so you can pay the remaining balance to the providers, or you can pay yourself back what you paid up front. With Medishare, your in-network doctor will bill you after collecting your $35 copay, but still expect a remainder bill after your discount. Are doctor's visits covered? Yes and no. Both Medishare and CHM have an app so you can speak directly to a licensed doctor online. The doctor can prescribe medications if you need it. There's no charge for using these services, and you can use them as many times as you need. If you need to see a doctor in person, then Medishare has a network of doctors you can go to. If you go in network, you pay a $35 fee, which is a down payment on your total bill. If your bill exceeds your annual household portion or deductible, then Medishare will reimburse you the difference. Otherwise, the total will be applied to your deductible and you are responsible for the remainder of the bill. Your deductible is $3,000. CHM covers any medical event within their guidelines when the total bills for a medical event add up to be $1,250 or more. So if you go to the doctor and you have to pay $80 out of pocket for your bill, it's not covered. With CHM, you save hundreds of dollars per month on their premiums versus commercial health insurance. So my advice is that you put a little money into savings each month so that you can pay the doctor's visits when you need to. If you go to the doctor and it turns out into a medical event or an illness, and the bills for this medical event, including testing, medication, follow-up, add up to be over $1,250, then you can submit the claim to CHM for reimbursement. I gave examples earlier in this video on how this works. I realize you may have a lot of questions after hearing this video. Drop me a comment below or go to our website, reviewhealthcare.org. There's a great frequently asked questions section and you can find most answers there. Also, like I said, just drop me a comment and I will answer them. Thank you for watching. I really appreciate your support and have a wonderful day. Take care. Bye.